Welcome back. It's an unproven drug, often touted by President Trump as a possible treatment for coronavirus.
What do you have to lose? Take it. I really think they should take it. Hydroxychloroquine. Try it. Hydroxychloroquine, which I think, as you know, it's a great malaria drug. It's worked unbelievably.
What do you have to lose? President Trump asked. Well, today, a new Veterans Health Administration study found no medical benefit to hydroxychloroquine when it comes to coronavirus patients, and that it could actually be harming patients who take it. Joining me now is CNN Chief Medical Correspondent Dr. Sanjay Gupta. Sanjay, you know, this is crappy news. We all want something to work. Take us through this study.
Right. Yeah, no doubt. We're all looking for some sort of therapy, and hydroxychloroquine is the one that's been getting a lot of attention. This is a study of some 368 patients. Still a small study, Jake. We're going to get larger data studies, so we have to take all of these studies with a little bit of a grain of salt. This one was not peer-reviewed. It was not randomized, meaning patients weren't put in one group versus the other, but in some random fashion. But nevertheless, exactly what you said, Jake, the patients who in this study got hydroxychloroquine and azithromycin, that's the Z-Pak, the antibiotic, this study, they did worse. They had close to a 22% death rate as compared to the patients who didn't get those medications, who had about an 11.4% death rate. So it doesn't look very promising. You know, this is another study among a drumbeat of studies now. Again, all of them pretty small. We're still waiting for the larger studies. But if you look at France, you look at Brazil, you look at Sweden, you're hearing similar things. In France, they said they found a dose that was too toxic. It was actually causing heart arrhythmias. In Sweden, they gave guidance to all the nation's hospitals to stop administering this medication outside of a clinical trial. So, you know, I think you framed it perfectly. We all want something that works. There's obviously been a lot of enthusiasm around this particular one, but so far, the results have not been that impressive at all, Jake.
Let's talk about this study of antibody testing out of Los Angeles County. It found the true number of coronavirus cases could be actually 55 times higher than traditional testing shows. In LA County, the study found 4.1% of adults are or have been infected. It seems remarkable. What does it mean?
Well, it's interesting, and this is the second. So there was a Stanford study that sort of showed the same thing. They had 1,000 patients confirmed up there and showed that it could be actually as many as 80,000 people who had been exposed to the virus, and similar sort of ratio here, you know, 40 times as many patients that it was actually exposed versus those were confirmed. It means two things. It's like most things, Jake. There's some bad news and good news in this. The bad news is that this virus has seemingly spread even more than we have thought. We've suspected this for some time. It's a contagious virus, and we haven't been testing adequately. So now we're starting to get a glimpse of just how far this has spread. But at the same time, Jake, many of those people who were subsequently, you know, thought to have been exposed to this either had no symptoms or they had minimal symptoms, which in part is good news because that brings down the overall fatality ratio. Fatality ratio is the number of people who've died over the number of people who've had these confirmed infections. If there are more people who've had the infections, then that's going to bring down the fatality ratio. We still don't know what it is. It seems to be variable country to country, even region of country to other regions of country. But if there's a lot of people out there who aren't getting sick from this, it means it's widespread, but not as deadly as with the few confirmed infections that we have.